All right, so clinical optics and vision rehabilitation. Again, shout outs to all of the people who have worked really hard on developing and writing all of this section. Starting out, it's just kind of giving you a quick start guide and some basics. I think that if you're getting ready to start ophthalmology and you're trying to get a better understanding of just the basic ideas of what you need to be able to function well in the clinic, this is probably a good place to start. I'm sure that during your orientation, you'll be learning how to refract and use the retinoscope. This kind of gives you all of the really helpful initial principles, and it's probably a good reference to kind of go back to in terms of learning how to manage refraction. And then here are some of the more kind of detailed physics side of things, some of the different techniques, how to correct different kinds of refractive errors using contact lenses. And intraocular lenses is such an important part now, since now it's no longer can we take out a cataract, but how well can we get people to see as well as possible without glasses after surgery. So that's also really important, the power calculations, trying to consider all of these other special situations, some of the optical instruments and how they work. Vision rehabilitation is also such an important factor now for what we do. Let's dive in real quick. So they kind of show you some practical thoughts on visualizing what you do. You'll have so much fun studying these ray diagrams. A lot of this is visual, so just being able to visualize the concepts. We underestimate how much optical principles go into some of the vision complaints. And so as you're reading through this section, really kind of take some time and think through how would a patient describe a problem with their vision that might represent this particular type of principle. Let's dive into pathology. So again, shout outs to all of these wonderful people who have really worked hard at putting this section together. Pathology, I think, forms the basis of a lot of how we understand many diseases. As a beginning resident, I didn't really appreciate how much pathology would form the fundamental understanding certain diseases work and how we treat them. Just want to encourage you to crack open this book early on and use it in conjunction with the other sections to learn the diseases you face and some of the other concepts that we talk about in greater detail. So here are the sections. The first little part is just kind of discussing the framework and techniques for thinking about pathology. But the other part of it is that there are some really helpful things. I'd start with this introduction to part one. It gives you a lot of really great insight into how to structurally think through histopathology, as well as just kind of understanding how to organize diseases. The other part of it is wound repair, which is also a very clinically useful section, so definitely want to read that. And then it just goes through each different part of the eye, kind of breaks it down into the more common things and pathologically significant types of diseases. And so it's not a comprehensive list of all of the diseases of the eye, but it does cover a lot of the same diseases that you'll see in other sections. So I would say use this book as a kind of a companion to whatever section that you're reading so that you can kind of understand what's going on under the microscope there. The other half of this is looking at intraocular tumors. There's a whole chapter on retinoblastoma, super high yield stuff. All right, so let's dive in here. Notice that there's even some activities that you can do online, so all of that's really helpful. There's just tons and tons of images, which are really, really helpful. Your written examinations, you'll see histopathology slides, and if you can recognize key cells or key patterns on the histopathology, that might give you just that extra edge to be able to quickly recognize what the question's talking about and be able to answer the question. So wound repair, super high yield chapter. Here's keratoconus, clinical picture. Look at all those great slides kind of showing different features. You might have read about them, you might continue to read about them, and you'll say, I don't know what that really looks like. If you just go to this book, you can see it. A lot of really good practice questions at the end. Great stuff.